I was asked to speak from a nurse's perspective today on how do I treat CAR Ts, and that starts with integrating nurses from the get-go in program development. So it should be a multidisciplinary approach, and nurses really led the way at UCSF. So that's everything from identifying the current facilities and seeing what facilities need to be expanded in order to meet your volume predictions. So things like staffing and inpatient beds, your apheresis lab, your stem cell lab, to education, making sure that all nurses receive proper training for this novel therapy, make sure that they have access to any protocols that are unique. So we have an online system where nurses or other providers can access information any time of day, 24 hours a day, and that would be the protocol, and also how to manage the unique toxicities. And then obviously the bedside care, how to evaluate for the unique toxicities, and then how to properly manage them. I think that because nurses also play a role in sort of the nurse coordination piece, so they're involved when we do patient selection. Is this patient appropriate or not for CAR T therapy? They're then used as nurse coordinators along the way, basically helping patients walk this really novel path of undergoing CAR T therapy, managing the toxicities, and then the aftercare, which is that they have to stay locally for 30 days following the infusion with a caretaker. So the psychosocial piece of it is very involved as well. And then I think because this is it's a new treatment, that there's also a lot of opportunity for nursing research or nursing-led research, particularly in areas around quality of life and the impacts of this, of this particular treatment with a very unique, at least currently, a very unique patient population. So I've been in nursing for about 2 decades now, and I remember in the beginning of my career when patients would ask me about ways that we could use their immune system to potentially treat their cancer, and I feel like in the beginning we didn't have a very good answer for that, and now we have a really strong answer for that with all of these emerging immunotherapies in oncology. And so I think that from a patient perspective, that's obviously very exciting, and from a nurse's perspective, we now have, I've said the word novel again, but we now have a new treatment for our patients to receive. It's a different modality, and it really presents an opportunity for either a durable remission or potentially a cure for people that have been heavily pretreated and are multiply relapsed.